Hello viewers, welcome back to another episode of our Critics Tech channel. Some of my friends have asked, is COVID-19 to blame for the black fungus and white fungus diseases? In the meantime, a section of the media has practically linked COVID-19 to these ailments. Black fungus disease is an obvious result of coronavirus. Such impression is spreading because of social media, particularly WhatsApp. But how true are these widely circulated messages? Let's see what we can find out. In medical terminology, black fungus is referred to as mucormycosis, which earlier was known as zygomycosis. Previously in India, mucormycosis was thought to be rare or non-existent. However, in the midway of the second wave of COVID-19, the government of India has requested all states to designate black fungus disease or mucormycosis as notifiable under the Epidemic Diseases Act, which was enacted some 125 years back in the year 1897. Anyway, following the central government's advice, numerous states, including Telangana, Odisha, Tamil Nadu, Rajasthan and Gujarat, have designated black fungus a notifiable disease. Karnataka has also decided to follow the center's advice, despite the fact that no deaths have so far been reported in this southern state. However, now to add to the concern about black fungus, stories of white fungus are also surfacing. However, in this episode, we will talk only about black fungus or mucormycosis disease. In fact, we will talk about at least half a dozen topics here, and we shall begin with the first question: is mucormycosis caused by COVID-19? Second, what are the different types and symptoms of mucormycosis? Third, who usually gets infected by mucormycosis? Fourth, how is mucormycosis diagnosed? Fifth, what are the options for treating mucormycosis? And last but not the least, how to reduce the risks of mucormycosis? Let's start with the first one. Is mucormycosis caused by COVID-19? In response to this query, a Critics Take wishes to inform the viewers that COVID-19 is not to blame for the spread of black fungus illness. The increase in occurrences of black fungus in India is due to several flaws in the management of COVID-19. Many people recovering from COVID-19 have of late been diagnosed by black fungus or mucormycosis disease. Yes, it's a fact. The fungus spreads into the cerebral areas via sinuses, and patient could die in 50 to 80% of cases if disease progresses unchecked. Mucormycosis can affect different parts of the body, showing different sets of symptoms. We shall discuss this after some time in this episode. However, it's worth noting what Dr. K.C. Rondello remarked. Dr. K.C. Rondello, an epidemiologist and special advisor at Adelphi University, has explained mucormycosis is a rare, invasive, fungal, opportunistic infection that causes serious and sometimes fatal disease. Black fungus infection actually is caused by a group of molds called Mucormycetes that typically live in soil and decaying organic matter. Mucormycosis normally does not spread person to person, but since it's an environmental mold, one can contract the fungus by inhaling the mold spores or when comes into contact with certain things like soil, rotting produce or rotting bread, compost piles, etc. When the immune system has been breached by another illness, fungi that are otherwise harmless take the advantage and invade human tissues. That is why these are called opportunistic infection. In tropical areas like India, spore counts are generally higher during the summer than during the monsoons. And 5 to 10 species only account for more than 90% of the total spore density in the year. As it happens, anywhere and everywhere, these spores can be found in both government and private hospitals also. Many pathogenic fungi that cause fungal illness can be found in hospital air. Mucormycosis can occur when people with a compromised immune system, like in case of COVID-19, inhale mucorspores in hospital areas. During the second wave of COVID-19 in India, clinics and hospitals were overcrowded with patients. Doctors were under pressure and patients were panicked. As a result, the physicians had what you call knee-jerk reactions. Patients with coronavirus infections were given antibiotics, antivirals, steroids that were not required. Irrational and overuse of medicines further depressed body's immune system, making the patients more susceptible to secondary infections such as mucormycosis, which might have been triggered by mold-tainted oxygen pipes and humidifiers inside hospitals of both private and public. Thus, COVID-infected patients with comorbid conditions like diabetes who were treated with steroids had resulted into further compromised immunities, and they had a considerably increased risk of fungal infection like mucormycosis due to inadequate hospital management and misuse of drugs. So, COVID-19 is not to be blamed for the rise in mucormycosis cases. Nonetheless, it is necessary now to become more acquainted with various symptoms of mucormycosis since the cases are on the rise. So, let's go to the next point. Our next point is, what are the symptoms of mucormycosis? In fact, the symptoms of mucormycosis depend on where in the body the fungus is growing. When mucormycosis hits sinus and brain, people suffer from one-sided facial swelling, headache, nasal or sinus congestion and fever. Black lesions are seen on nasal bridge or upper inside of mouth that quickly become more severe. Symptoms of pulmonary or lung mucormycosis include fever, cough, chest pain and shortness of breath. Skin mucormycosis can look like blisters or ulcers, and the infected area may turn black. Other symptoms of skin mucormycosis include pain, warmth, excessive redness or swelling around a wound. Gastrointestinal mucormycosis include abdominal pain, nausea and vomiting, gastrointestinal bleeding, etc. Disseminated mucormycosis is typically occurring in people who are already sick from other medical conditions. So, it can be difficult to know which symptoms are related to mucormycosis. Patients with disseminated infection in the brain can develop mental status changes or even coma. Now let's see who usually gets infected by mucormycosis. Mucormycosis is rare, but it's more common among people who have health problems or who take medicines that lower the body's ability to fight germs and sickness. People with diabetes, cancer, organ transplant, stem cell transplant, low number of white blood cells in the body, long-term corticosteroid users, skin injury due to surgery, burns or wounds, prematurity and low birth weight are more common or more likely to get mucormycosis. Mucormycosis or black fungus is not contagious. It can't spread between people or between people and animals. Now let's see how is mucormycosis diagnosed. Many people are oblivious to the fact that they have mucormycosis. There are no reliable serological or blood testing. As a result, if you suspect that you have an infection, see your doctor first. Your doctor will determine whether you have mucormycosis, and that too based on your medical history, symptoms, physical examinations and laboratory tests. A sample of fluid from your respiratory system may be sent to a laboratory if your doctor suspects you have mucormycosis in your lungs or sinuses. A tissue biopsy is also an option. You can also get a CT scan of your lungs and sinuses. In the event of a skin infection, your doctor may also clean the affected region. To diagnose gastrointestinal mucormycosis, endoscopic biopsies of the lesions can be performed. Percutaneous biopsy or nephrectomy can be used to diagnose isolated renal involvement. However, our doctor is the best judge of whether you have mucormycosis infection in any of these conditions. So let's look into the next question. What are the options for treating mucormycosis? Yes, mucormycosis is a dangerous infection that requires medical attention. Your doctor may prescribe antifungal drugs as soon as you have been diagnosed with mucormycosis. Amphotericin B, posaconazole or isavuconazole may be prescribed. These medications may be given to you in high quantities by intravenous infusion or as pills to swallow. These medicines stop the growth of the fungus, kill it, and bring the infection under control. However, it may take several weeks. Please note, if a medicine causes unpleasant side effects such as stomach pain, heartburn, or difficulty in breathing, inform your doctor. Your doctor may be able to help you by modifying the treatment approach. To prevent the fungus from spreading, your doctor may recommend surgery to remove infected or dead tissue. This may include the removal of portions of your nose or eyes. It has the potential to be disfiguring. However, treating this life-threatening infection is very, very crucial. Let us now turn our attention to the final topic of this episode for discussion. How to reduce the risks of mucormycosis. Because mucormycosis isn't communicable, you can't catch it from someone who has it. Self-care is the most effective strategy to avoid contracting these infections. There are a few simple steps we can take to reduce the risks of contracting mucormycosis in patients who require hospitalization. To begin, we must sample the air in hospitals on a regular basis to check for the presence of spores, particularly in critical care wards. Second, the humidifiers that are used during oxygen therapy must be sterile. Third, recovering patients should be advised to stay indoors until their natural strength and immunity have returned. Fourth, patients who work in agriculture or gardening should be advised to take time off until the infection is completely cured. It is, in fact, our social responsibility to educate society about the black fungus disease in general. Anyone with a weaker immune system should avoid going outside if possible. Taking extra precautions during the summer and autumn months, when the number of fungi in the environment is higher, is absolutely a good idea. Anyway, with this, we would like to bring today's episode to a close. During today's episode, we tried to explain the link between COVID-19 and black fungus disease. We also attempted to explain a few key elements of black fungus infections in layman's terms in order to raise awareness about the disease. I hope the video was helpful to the viewers. Please share this video with others if you enjoyed it. We will talk about white fungus in the upcoming video, so please stay tuned. Thank you for watching our Critics Tech channel.